and welcome to Forever Youthful with me, your host, Dr. Jaishree Sharad. We've talked about the aging phase. Let's now discuss the aging periorbital sockets. What does that mean? Is it Greek and Latin? Well, I'm only talking about the area around your eyes, the under eye hollows. The eyes are the most attractive part of the face. Now, if you have dark circles or if you have sunken eyes, there is a shadow which is cast and the eyes look tired. Even if you've slept for 12 hours, it doesn't look as if you're fresh. What do you do? Now, this happens both in youngsters and in more mature people. In youngsters, genetically, this bone here called the maxilla is more concave. And because it is concave, the soft tissue also tends to be a little hollow. And there is this sunken eye appearance. As we age, the bone, which is the orbital rim, tends to get resorbed, and the fat, which is the deep fat, is lost. The muscle becomes thin, and the superficial fat starts to herniate downwards. And so one develops these sunken eyes, or what is called the infraorbital hollow. So both in youngsters who have a genetic deformity and in older people who lose this fat and bone with age, the treatment is hyaluronic acid filler injections. Hyaluronic acid is a part of our own skin. It tends to get depleted as we age. So when we put back hyaluronic acid, it tends to absorb water because it's hydrophilic and it swells up a little. So it plumps up the skin, which is there under the eye. So hyaluronic acid fillers are given either with the help of a needle or with the help of a cannula under the eye. The product is placed right on the bone. Now, if this product is placed more superficially, it will create a tyndall effect or a bluish discoloration. So please make sure you go to an injector who is well trained, who is knowledgeable, and who has a very artistic eye. The key is to keep it subtle and natural and never overdo fillers in this area. Sometimes if you overdo fillers, hyaluronic acid, as you know, will absorb water and the eyes may look puffy. All in all, hyaluronic acid fillers under the eyes is good for all age groups from the age of 22 onwards. And the beauty of hyaluronic acid is that it can be dissolved with an injection called Hyaluronidase. So should you not like the effect, you can just get it dissolved. It disappears in 24 hours. Otherwise, of course, the effect will last for at least a year. Hyaluronic acid also stimulates your body's own collagen. So if you stop injecting after a year, you are never going to go back to square one. Neither is your skin going to look worse because there is new collagen which is formed. So you will always be better than what you were when you started the injection. The common side effects are swelling and bruising, which will last for anywhere between 5 to 7 days. But it's all very temporary. Lumps and bumps or tyndall effect, which is that bluish discoloration, can happen if the wrong product is chosen or if the injection is too superficial. So always go to the right injector. So that's about filling this area. However, if there is hyperpigmentation or dark circles, then one will need to use some skin lightening creams, or one can do glycolic acid peels or Q-switch Nd:YAG laser to treat the hyperpigmentation as well. Post your comments here, ask your questions, like and share my video, and do subscribe to Forever Youthful.